So welcome to the ERN ReCONNET webinar on health economics. This is the first webinar we have on this topic. And today we have with us Professor Giuseppe Turchetti from the Scuola Superiore Sant'Anna, who will introduce to us the health economic topic. And this is the first of our webinar, and we will have more webinars coming in the future. And just to tell you that we have the possibility to ask questions both in the chat and in the question and answer that you see in the lower part of the window. There is a bar and you can click and you can post your questions and we can answer during the webinar. So I think, Giuseppe, we can start.
Okay, thank you, Diana. Good afternoon, everybody. My name is Giuseppe Turchetti. I'm an economist, health economist, actually. I work in Pisa, the Scuola Superiore Sant'Anna, that is one of the 3 universities that are based in Pisa. I've been working on the economic application to healthcare since the beginning of the 90s. I've been working with many groups on many different topics. And today I've been asked to introduce to you the rationale of the economic reasoning in healthcare. So I thought that it would have been interesting to first of all to address why the economic reasoning is very important, in particular nowadays, when the economic reasoning and the tools that we use for the economic analysis have to be used. So which is the proper timing to use, when to use these techniques, and how. How means which are the most important tools that we can use in performing the economic assessment, the economic analysis. We will have, as Diana was saying, some other seminars where we will analyze in more detail some of the topics that we will address today. So these are the three steps that we will follow in this half an hour that we will stay together. Why, when, and how. Why? I would like to start from this chart. This chart shows the evolution, the dynamics of the healthcare expense as a total healthcare expense, so public plus private, of the GDP of the largest European countries, of Europe, 28 countries, and in the US. And this chart, even if it is quite aggregated in terms of data, shows us several issues. The first one is the impact, the weight of the healthcare expense over the GDP of these countries and of the EU 28. And on average is about 10%, with some differences between France, Germany, and, for example, Italy and the UK. A totally different analysis should be done for the US, but it would really take too much time to go into details of the differences that we can see here in this chart between the US and the European countries. So the first information is related to the weight of the total healthcare expense of the GDP. It is not visible here the weight of public healthcare expense of the GDP or private healthcare expense of the GDP of the different countries, but this is really very peculiar, very specific on the to the nature of the healthcare system that each single country has in place. For example, if we take Italy, Italy has about 9% as a total healthcare expense, and the private total healthcare expense is almost 1/3, but the specificity of this 1/3 is that, and this is not good in terms of equity of access to the healthcare, is that let's say the vast majority of this private healthcare expense is out-of-pocket expense and not an expense that is intermediated through insurance companies or through the insurance mechanism or through healthcare funds. The important issue that the other important issue that we can see and read in this chart is the evolution. The evolution is, as you can see, for example, analyzing the data related to the European countries, 28, you can see that this is a ratio that is going up in the years. And this is particularly important to notice because this is from this evolution raises the concern that the different countries have with respect to these dynamics and to the economic sustainability of our healthcare systems. Why there is this concern? This concern is related to two different reasons. The first is the dynamics of the numerator of this ratio, so the total healthcare expense. And the total healthcare expense, as also we will see in the next chart, is growing, is going up, and it will go up even more in the near future. And in the next chart, I will try to highlight some drivers for this increasing shape of the total healthcare expense. On the other side, on the contrary, I would say, the denominator of this ratio, so the GDP of our countries, is not going up. So, and actually in the last 10 years, in several years, in many countries, European countries, the value of the GDP has decreased in some countries. So this is the source of the real concern that in many countries we have about the economic sustainability of our healthcare systems. From the one side, the numerator is going up, the total healthcare expense is going up. On the other side, the denominator of this ratio is not moving at the same pace and sometimes not even in the same direction. So this is the most important reason why there is a strong concern in Europe about the economic sustainability, the financial sustainability of our healthcare systems. And which are the drivers, the main drivers that drive the numerator of that ratio, so the total healthcare expense, up? Here I highlighted some of the most important ones. One is the aging of the population. Hopefully we live longer, and this is very good news because of many reasons, because in particular of the role of the last driver here in this chart of innovation, because we have many more opportunities both in diagnostic and in the therapy. So for many diseases we do not die anymore, and so we are able to manage many chronic conditions, many diseases. So our life expectancy goes up. And so we will require treatment and monitoring for more years. So the healthcare expense will go up. The second reason, that even more important, is the presence of many chronic diseases. Actually, for many diseases that so far have been lethal diseases, like many tumors, many diseases in the oncologic area are improving. So we do not die anymore. In many diseases, we are nowadays able to chronicize the disease. So we will live with a tumor for many years, maybe for the rest of our life. So during our life, the rest of our life, exactly because hopefully we do not die anymore, we will require treatment, we will require diagnosis, we will require monitoring. So the total amount of services, healthcare services, of procedures that we will require in the years will increase, and so the healthcare costs. Another important driver is the new meaning of health and well-being that is in place, in our society nowadays. If we take, for example, the definition of health that is provided by the World Health Organization, we can see that this definition is totally different from the concept that of health used to have our grandparents. For our grandparents, to be healthy meant simply not to have a disease. Nowadays, in the concept of health, there is a much wider dimension of health, or wellness, is not simply not to be affected by a disease, but to be in a very good mood from the psychological point of view, for the way in which we manage our relationships with our partner, with our friends, with our ability and capacity to work and to provide our contribution to the society. So it's a much wider definition of health. So if something is not totally compliant with this definition, something pathological starts, enters into the scene, and so it requires diagnosis and treatment. So on average, the total amount of procedures increases, and so the healthcare costs. The last driver that is in this chart is innovation. Innovation is the reason why we live longer. We live with a much better quality of life. We have many innovations in the pharmaceutical area. We have many innovations in the medical devices, in the large and big technologies, medical technologies. So because of this innovation, we live longer and we live with a much better quality of life. On the other side, as I was saying before, this impacts in the number of procedures that we perform and in the lifetime horizon that hopefully is increasing, is getting longer and longer, and so we will perform in the near future many more procedures than we used to perform in the past. So this will inevitably impact on the healthcare costs. So coming back to this chart, from the one side we have the numerator of this ratio that is going up, and it will go up even more in the next future. And on the other side, if the denominator, so the GDP, is not going up at the same pace, of course this creates concern about the economic sustainability of our healthcare systems. So this is why it is important to address and to have in mind, very clearly in mind, this economic dimension. So one issue that is worrying our governments is how to properly, satisfactorily manage this trade-off, the trade-off between innovation and economic sustainability. This is not an easy trade-off to manage, because in the near future, hopefully, we will have a very significant wave of innovation in many diseases, in particular in terms of new medical devices, in terms of new drugs. Some of these new drugs are based on new technologies, on new techniques also of production. from chemistry, we are moving to other dimensions, to biological drugs, and now to drugs that are based on genetics. So the development of these new drugs that will be much more powerful than the previous ones will require high cost, and so the impact would be, it is expected to be significant. So how to manage if our economies do not grow properly this higher expense that is expected in the drug segment. So the governments are really facing this trade-off: how to properly manage the access to innovation and the wide diffusion of innovation and the economic sustainability of the healthcare systems. Just to say it in a little bit harsher way, how much innovation can we afford? This is a real question in many of our countries. We will be able to afford all the innovation that will enter into the market in the next years. And this is an important question. And of course, nobody would face the worst scenario possible, the scenario in which the innovation is there, the solution, a new treatment is there, and we cannot afford it. So this would be really the worst scenario possible, because this would introduce equity issues, equity of access to this innovation for everybody. So this is an important topic to address. So living in these times, facing these trade-offs, which is the role of economics? Economics is about limited resources, where resources are not only money, as we have talked so far, but are also competences, are also time. We may have many resources that are important to manage our health and our healthcare services that might be limited. On the other side, we might have unlimited needs or unlimited opportunities that will face into the market, enter into the market in the near future. So economics is about how to choose between needs that are potentially unlimited and limited resources that are in a given budget that we are available. So economics, health economics in this case, helps us in properly managing this trade-off, and in providing all the different information and data to decision makers to properly choose with this respect. So this choice very often is between two or more options. So the overall idea and the overall objective of our society, of our health policymakers that use health economics as an information, as a source of information, is how to maximize the health of the population given our constrained health resources that are available. So this is the rationale, and why is it really important to also focus on health economics and to adopt the tools that come from the health economics. So when to use these tools, which is the best timing for this approach? Actually, the time is before the execution of the healthcare activities. So in the planning phase, as we will see in the next slide, during the management of the activity, so during the provision of healthcare services, but also after the execution of the activity. So in terms of assessment of the procedures, also from an economic point of view, trying to always improve the procedures or the process or the economic implication of the procedure. In order to better specify when these health economic tools might be used, I would like to show to you this chart that provides us several answers to this question. In this chart, you see the different areas of interest of health economics, so the different areas of interest of economics in the healthcare sector. Very quickly, we go in alphabetical order across these boxes. For example, one interesting question for a health economist is which factors influence our health? In addition to the presence of effective healthcare services that are in place, which other factors influence our health, the health of a population? And here, as you know, there are many socio-economic factors that may impact on the health of a population. So this is an interesting area of research and of interest of the health economists in this area. So typically this takes place in the planning phase, because first of all we have to understand which are the most important drivers of our health. And a second box is even more philosophical, that is, what is health? And in particular, what is the value of health? And this is a very harsh question, you know, to give a value, an economic value to a health dimension, you know, like our sight or our ability to move, or even to our life is really a very harsh question. But hopefully every day in our societies, in our systems, we provide an answer to this question. For example, if we have injuries during in a work site, or we have injuries because of a car accident, and people have a permanent disability, there is a system that is able to assess this disability and to provide a reimbursement for this disability that we all know that will not restore the functionality, the lost functionality, but at least with this money we should be able to better cope with the disadvantages related to that disability. So every day we answer to this question: what is the value of our health? Another very interesting area of interest of health economics is the box C. Here we have probably the most important area of interest of health economics, of economics in the healthcare sector. That is, which are the determinants of the birth of a demand for a specific healthcare service, of a healthcare procedure in the healthcare sector. And this is very interesting because healthcare is totally different from all the other sectors where we have a demand side of the let's call it the relationship between supply and demand, and the other side we have the supply side of this world. And in a typical market mechanism, the supply side of the demand is totally different from the demand side of the market. So in healthcare, very often we have in many procedures a mixed role between the supply side and the demand side of a specific healthcare service. So this is a very interesting and fascinating area of research for the health economists. The other area is in the D box. In the D box, there are questions like how should I size, how should I define the dimension and the nature of my supply side, so of the healthcare structure. So how many centers for the treatment of that disease, how many professionals for that disease, how many nurses. So the supply side of this area of the healthcare services. So this is another very interesting area of interest of the economists in the healthcare sector. And then we have box E. Here there is a very interesting area that is related to the tools, the economic assessment tools that we use to evaluate an innovation, for example, or a healthcare procedure or a healthcare system overall. And here we find the different techniques, health economic assessment techniques that we use. We talk about cost effectiveness analysis, cost utility analysis, cost benefit analysis, cost minimization analysis. And we will come back on these techniques in a next session, in a next seminar, because these techniques are very, very important. And all of us, all of you use every day these techniques, both in planning a new procedure or planning the introduction of a new treatment, a new drug, a new medical device, but also ex post when you have to assess the cost effectiveness, for example, of a new treatment that has been used in the clinical practice. So we will come back because these techniques are very, very important. Another area of interest of the health economist is, for example, how to define the tariffs, the amount of the DRGs, how to properly manage the relationship between demand and supply, so how to properly reduce and manage the waiting list for specific procedures. This is an issue that is related to finding an equilibrium between supply and demand. And again, in this topic, the tools that come from the economic reasoning, the economic theory, are very important. Another box is the G, and here we can find some techniques that help us in comparing different healthcare systems, for example. There are many studies that compare the US healthcare system with respect to the UK, to the French, to the Dutch, or to the Italian, or to the Spanish healthcare system. And we can compare different healthcare systems according to different dimensions. For example, how productive a healthcare system is with respect to the others, how efficient or how equitable a healthcare system is with respect to other healthcare systems. So this is a very fascinating box, a very fascinating area of interest of the health economists in this field. The very last in this chart is box H. And here you can find probably the dimensions that you probably immediately came to your mind talking about the role of economics in healthcare. So to define a budget for a unit, for a department, for a hospital, for a regional administration, and to monitor the dynamics of the healthcare expense in a hospital, or the drug, the expense in the pharmaceutical products, or in other products in a hospital, in a specific department, and so far. This is a very important box, definitely, but as we have seen, this is not the only one. Typically, the analyses that are performed in this kind of box come at the beginning in terms of provisional budgets, and then also ex post in terms of monitoring after the and assessment after the provision of the procedures. But also the other boxes perform analysis that take care. In this respect, we answer to the question, when do we use the economic reasoning in healthcare? We can use this economic reasoning either before the planning, during the provision of the services, but also ex post in terms of assessment, post assessment, and in terms of continuous improvement of the different processes. For example, I mentioned new drugs, so new pharmacological treatments. For example, typically the economic analysis comes before the introduction of a new drug into the clinical practice. In this respect, we perform cost efficacy analysis or budget impact analysis. And these analyses are aimed to try to estimate which is, in a comparative way, cost efficacy analysis, the impact of the new drug with respect to standard of care, to drugs or to treatments that are nowadays in place. Or the second analysis, budget impact analysis, is focalized to try to estimate the overall impact on the budget of the department, of the hospital, or the regional administration, or the overall healthcare system due to the introduction of a new procedure, a new drug. And then we also perform this analysis, this economic analysis, after the introduction of the drug into the clinical practice, and we perform collecting data in clinical practice, cost effectiveness analysis, trying to estimate, to measure, which is in a practical way, in a real setting way, the cost effectiveness of the new drug with respect to the standard of care. But also in this phase, we measure quality of life indicators, we measure prompts, and so on. So the economic analysis, as you have seen in this example, comes either both before and after the introduction of a new drug into the clinical practice. Then the last step, how health economics, which are the tools that typically we use. And in order to answer to this question, I would like to highlight three, as I call them here in this chart, a three-step approach. The first step is to properly assess the economic burden of the disease, and in the next chart I will tell you what I mean. The second is to properly design and run comparative economic analysis. And the third is to properly design the organization for managing the disease, for managing the patient during all the pathway. So with respect to the first step, properly assess the economic burden of the disease. Why I stressed this issue? I stressed this issue because even if we have different families, different components of costs, like direct healthcare cost, direct non-healthcare cost, indirect cost, and quality of life costs, very often, and I will provide a little bit more detail in the next chart, even if we have many different families of cost in many studies, in many economic evaluations, we only focus on a subset of direct healthcare costs, like, for example, the cost of the treatment, the cost of the devices that I use for the treatment of the patient, or the days of hospitalization, and so on. And we risk to totally neglect many other economic implications that are equally and sometimes even more important than the ones that I have mentioned. So the partial aggregations of the different families of costs provide useful information for estimating the terms and the intensity with which the different components could affect the patient, his or her family, or the society overall, on top of the healthcare system per se. So which are the different families of cost? In the previous chart, we have seen direct costs, and direct costs are costs that are directly related to the treatment of the disease, to the management of the patient. And these direct costs might be healthcare, direct healthcare costs, or direct non-healthcare costs. The first ones are the ones that I mentioned before. So the cost of hospitalization, drugs, tests, instrumental tests, the diagnostic, all the cost of the healthcare professionals and so on, or the cost of rehabilitation and so on. But we also have direct non-healthcare costs, like, for example, the transportation of the patient to the clinic or to the rehab center or to the diagnostic center, and also the informal care that is provided by relatives and friends outside the working time hours. And then we have the indirect costs. The indirect costs are based on basically the loss of productivity. So the working days that both the patient or his or her caregivers and family may lose because of the disease, because of the treatment, because of the diagnosis that has to be done. So this is a loss for the patient, for the family, for the economic system, for the society overall. And then we have costs that are called intangible costs that are more related to the impact on the psychological side of the patient, of his or her quality of life. And these are costs of psychological and social nature related to the disease. And in many, many diseases, these are the most important costs. For many diseases, this family of costs is even more important than direct costs or indirect costs. The typical example that we make when we highlight this concept is, for example, the Alzheimer's disease. Alzheimer's disease is not that expensive in terms of direct healthcare costs, because unfortunately so far there are not valuable treatments available. The real issue is to assess the impact of this disease in terms of direct non-healthcare costs, in terms of indirect costs, in terms of psychological costs for the patient, for the family. So these are the real costs. This is the real burden of the disease. So if we do not consider, as I've stated here on the right side of this chart, all the different categories, we risk to underestimate the impact of a disease, the real impact of a disease for the patient, the family, and the society overall. So I really invite you in when you will you will have to perform this economic assessment to take into consideration all the different families of costs. The second step is to properly design and run comparative economic analysis. And here the issue is more methodological, or let's say is again methodological, that it refers to the design, how to design and run robust economic analysis that could adopt this wide perspective, both in terms of outcomes and in terms of cost items. What I mean in this with this sentence, I mean that as for the cost items, so we have to take into account direct and indirect and quality of life costs. Also in terms of outcome, we should try to assess the impact of a new disease, of a new treatment, of a new procedure, definitely on clinical outcomes, but also on quality of life, but also on the experience of the patient, on the way in which the patient is able to manage his or her daily life, or reach his or her small but very important targets every day. So this is a very important issue to highlight and to increase it, include it in the outcome measures that we have to assess in this economic analysis. As I have said, here is a comparative analysis, properly design and run comparative economic analysis, and this matrix shows us the different economic evaluation techniques that we use to perform this comparative economic analysis. And here, but we will discuss about these techniques in another seminar. Here we have different techniques that might be divided in terms of these two questions. Do we compare two or more alternatives? So we compare alternative A versus alternative B, for example, treatment A versus treatment B, yes or no. And the other question, a key question, is do we examine the cost and the consequences? And yes or no. So we might, of every single alternative, assess either only cost or only consequences, or both cost and consequences. So when we answer yes to these two questions, we are in the domain of the economic evaluation techniques that we define complete, because they compare two more alternatives among each other, and of each alternative they assess both cost and consequences. And these techniques are these four that we will analyze in detail, try to understand which are the characteristics of each of those, when it's better to use one technique rather than another one, which are the potentialities of each of those techniques. And the four techniques are these ones: cost minimization analysis, cost benefit analysis, cost effectiveness analysis, and cost utility analysis. But we will come back in more detail on these techniques in another seminar. The first step is to properly design the organization for managing the disease and for managing the patient. And here the issue is about the how to optimize the diagnostic and therapeutic pathway of the patient. So we have to properly design in a very organized, codified way the care pathway, talking about starting from prevention to the role of GPs, of nurses, of hospital specialists, trying to find the proper balance between inpatient, outpatient, and home care activity. This is very important. This is really very important, not only from an health outcome point of view, because a patient that is managed in this very precise way, very planned way, will turn out to have a much better health outcome, but also from an economic point of view, because we reduce redundancies, we reduce inefficiencies, we reduce bottleneckness. So it's much, much better. So the message here is that organization matters very much. And here it's important. The role of the economic approach, of the economic analysis, is important. And under this respect, health economics could provide an important contribution to this, also to this third step. Conclusion. But also on this, on the definition of the care pathways, we will organize a seminar ad hoc on how to design these pathways. how to codify these pathways, how to measure with some KPIs, key performance indicators, the effectiveness, the efficiency, the productivity of these pathways. So we will end the economic implication of the adoption of these pathways with respect to not having them in place. So we will come back also with another seminar on this topic. So the last two or three slides as a final remarks, trying to highlight which is the role of health economics in healthcare management and in the design of a proper design of a healthcare policy. So it's in which direction should we move? It's very important to create a culture in all the stakeholders, of course, clinical culture, but also, as our seminar is focused on the economic perspective, on the economic dimension, also to create in all the different stakeholders the culture of innovation and how important the innovation is. Both the technological innovation, but also the organizational innovation. And this is important and is not easy because innovation is always produces reactions and also barriers, because innovation changes the way in which we work, the way in which we relationate with our colleagues, with the patients towards the healthcare professionals and towards the hospitals. So we must, on the contrary, have very clearly in mind that from innovation comes better quality of life, comes a better prognosis. So it's important to create the culture of innovation in all the different stakeholders. But at the same time, also the culture of sustainability, because if our systems will not be sustainable in the near future, all the innovation that will enter into the market and into the clinical practice will be totally useless, because we will not able to afford it. So we must always keep into account as a very important aim, a very important objective of our system, the sustainability. Then the appropriateness of the different treatments. Why I highlight the appropriateness? I highlight the appropriateness because not only because it's important in terms of health outcomes, but this is not, of course, my field, and I leave it totally to the clinicians, but because the appropriateness very often drives efficiency. So an appropriate treatment very often is also an efficient treatment from an economic point of view, from an organizational point of view. So this is important to be taken into account. And then the concept of value. So far in the economic dimension, in the economic reasoning, we highlight the importance of value for money. So the system, the healthcare system, invests money in the healthcare procedures, in the healthcare innovation, and which is the return from this investment. So the value for money concept is very important, of course, because as we have seen in the very first slide, resources are scarce, are not unlimited. So we have to use in the best way possible the resources. But the concept of value should not be articulated only in terms of value for money, but also value for the patient, value for the user, value for the professional, healthcare professional. So the concept, in the value concept, there are in the concept of value, there are many different dimensions that have to be taken into account in the analysis. So how could we do this? Producing evidence on the economic, also on the economic implications. Decision makers should always decide having data, having robust information. So let's invest in designing and in running robust, scientifically based economic analysis, because this will benefit all the different stakeholders. So let's invest in cost effectiveness studies, cost efficacy study when the new procedure, the new technologies are not in the clinical practice yet, but cost effectiveness analysis studies when the technology has been transferred to the clinical practice. So we will talk about these techniques, cost effectiveness analysis and health technology assessment of these new procedures. Why this is important? Because this, as I've said at the beginning, this is the worst scenario. When a treatment or the clinical decision is taken because of or is too much or is simply connected to the expense, the healthcare expense. This is not, of course, acceptable. Absolutely not acceptable. So we must give answers also as economists. Maybe not these ones, but unfortunately these are quite often the answers that you receive by your health policymakers. So like answers like, we don't know that it works, and we don't know that it doesn't work. It's the third way. So this is not exactly the answer that we would like to receive, but probably not even these answer. This manager is telling to this doctor, try not to think of it as a rationing. Think of it as an output maximization of priority indicators with it a limited budgetary scenario. So this is not an understandable language, and it is very clear from her face. We must absolutely speak the same language also on the health economic dimension. So it is important that both health professionals, but also patients and patients' representatives are much more aware of the health economic reasoning, not just to become experts, but to be able to understand the dynamics, to understand the rationale that is behind the economic reasoning, and to be able to discuss with all the other different stakeholders. So if we succeed in doing this, I really think that we would be able to keep together the high quality of products, of services, incentivizing and promoting scientific and technological innovation in a picture, in a framework of sustainability and equity of access of our welfare systems. And these are apparently trade-offs that are different, very difficult to keep together and to manage. But if we all work with the same language, we all work with the same objective, also taking into consideration the economic implications of our procedures, of our way of managing the healthcare, I do believe that we will be able to successfully manage them. Thank you. If there are questions, of course, I'm here. I'm happy to answer. In addition, you have here my email address, and I will be happy to provide more information or some readings if someone is interested in going a little bit more in detail in the topics that we have seen in this presentation. We will come back on, as I anticipated, several topics. definitely on the different economic evaluation techniques that are very much, very important in all your activity, daily activity, but also if you will be interested in the design of healthcare pathways and in their assessment. Thank you.
Thank you very much to Professor Turchetti. I see no question at the moment, so we have one, no question, but I thank you for a very clear presentation. Okay, great. Thank you very much.
Thank you.
Okay, another comment. Thank you very much. Very interesting and clear presentation. Okay, thank you so much.
Thank you.
So we will register, we will publish the webinar and we will see if there are any questions. So thank you very much. I think we can close.
Thank you. Thank you.
Thank you.
Bye-bye.
Bye.
Bye.